Obviously, nobody wants to have a fishy smell wafting up from the general vicinity of their vagina. But many people experience a mysterious fishy vaginal smell at some point, prompting them to wonder why on earth their vagina smells like something other than a vagina. Even though it may be less than lovely, a fishy vaginal smell is also kind of a helpful thing to notice. This unusual scent is typically a solid tip-off that something is off with your vaginal health. Lauren Stryker, MD, an associate professor of clinical obstetrics and gynecology at Northwestern University Feinberg School of Medicine, tells Self. If you're dealing with a fishy vaginal smell and wondering what's going on down there, here's what you should know. What's the most common cause of fishy vaginal odor? If you have a distinctly fishy smell emanating from your vagina, it's highly likely that the cause is bacterial vaginosis (BV), Dr. Stryker says. BV is an infection that develops when the natural balance between the healthy and unhealthy bacteria that normally populate your vagina is thrown off by an overgrowth of bad bacteria, according to the U.S. National Library of Medicine. Watch this: why Dawn Harper Nelson sacrifices it all for Olympic medals. If you have BV, you're in good company. It is the most common vaginal infection in women between the ages of 15 and 44, according to the Centers for Disease Control and Prevention, CDC. It also mostly affects sexually active people. Although we don't know how, exactly, sex contributes to developing BV, it is known that having a new sex partner or multiple sex partners can disturb the bacterial balance in the vagina and place you at an increased risk for BV, the CDC explains. Although some people with BV don't have any symptoms, white or gray vaginal discharge with that signature fishy smell is indeed a common sign of the condition, per the U.S. National Library of Medicine. The fish-like smell might be especially noticeable after sex, the Office on Women's Health (OWH) explains, and accompanying discharge may be foamy or watery. Other symptoms include itchiness in and outside the vagina and burning when you urinate, per the U.S. National Library of Medicine. Fortunately, BV is simple to diagnose and treat. Along with a physical exam, your doctor will take a sample of vaginal discharge to check for harmful bacteria indicating BV, the OWH explains. Treatment is straightforward: prescription antibiotics in the form of a pill or vaginal cream, per the U.S. National Library of Medicine. And while any sex partners with penises don't have to worry about getting BV, sex partners who have vaginas do, according to the OWH. They should see a doctor in case they also have it. There are a few things you can do in the meantime to help reduce further vaginal discomfort or irritation. They include staying out of hot tubs, using unscented pads or tampons if you're on your period, fragrance can be irritating, and sticking to breathable cotton underwear, according to the U.S. National Library of Medicine. Another big one: don't wash inside your vagina. It's a self-cleaning organ. Thanks, discharge. While it's okay to use a mild, gentle soap on your vulva, don't put soap of any kind into your actual vagina, it can just cause further irritation. Rarely, a fishy smell may indicate something else. It's unlikely but possible that a fishy smell is a symptom of something besides BV. The main possibility is trichomoniasis, a common sexually transmitted infection, STI, caused by a parasite. It can create a foul-smelling vaginal discharge that is white, gray, yellow, or green, in addition to genital itching, redness, burning, and pain when you pee or have sex, the Mayo Clinic says. OB/GYN Jessica Shepard, MD, Director of Minimally Invasive Gynecology at the University of Illinois at Chicago, tells Self that a fishy odor isn't required for a trichomoniasis diagnosis, but it's a possibility. You can have an odor, but it's not typical, Dr. Shepard says. But if you do have an odor, it could be fishy. Like BV, trichomoniasis is typically diagnosed by testing a vaginal fluid sample and treated with antibiotics, the Mayo Clinic says. Another potential but less likely fishy odor culprit is pelvic inflammatory disease (PID), an infection that usually happens when sexually transmitted bacteria, often from an untreated STI, spread from your vagina to your uterus, fallopian tubes, or ovaries. Christine Greaves, MD, a board-certified OB/GYN at the Orlando Health Center of Obstetrics and Gynecology and surgeon at the Winnie Palmer Hospital for Women and Babies, tells Self. Although PID usually causes no signs or symptoms, besides a fishy vaginal odor, it can sometimes lead to pelvic pain, bleeding during or after sex or between your period, a fever, pain when you pee, heavy vaginal discharge with a foul odor, and even trouble getting pregnant due to scarring of your reproductive organs, the Mayo Clinic says. PID diagnosis involves a pelvic exam, a testing of vaginal discharge and cervical cultures, or urine tests, per the Mayo Clinic. Treatment usually consists of a combination of antibiotics, although in rare instances, more serious cases might require hospitalization and further treatment, according to the Mayo Clinic. Is there any way to prevent bacterial vaginosis and fishy vaginal odor? Here's kind of a bummer: doctors don't totally understand how BV spreads, meaning there are not actually any surefire ways to prevent it, the OWH explains. That said, there are a couple of basic measures you can take that may or may not reduce your risk of getting BV. They include not douching. Douching actually gets rid of the healthy bacteria that may help prevent infection, and using latex condoms properly each time you have penetrative vaginal intercourse, according to the OWH. Be sure you're wiping from front to back, too. Another easy way to potentially avoid infection and generally promote good vaginal health is to clean sex toys between uses, as Self previously reported. Technically, you can also not have sex or limit your number of sexual partners in an attempt to avoid BV, but as we said, doctors don't know for sure how to prevent the condition, plus, you have to live your life. Just doing our due diligence here and adding this as an option. As for preventing that fishy odor if you are currently dealing with BV, the best thing you can do is get proper treatment ASAP, because the smell will go away along with the infection. And avoid the temptation to spray perfume anywhere remotely near your sexual organs. It's not going to cover the smell up, and it may just irritate your vulvar skin, Dr. Stryker says. Bottom line here, be gentle with your vagina, and see a doctor if something's up, fishy odor or otherwise.